there was. Hundreds of patients with metastatic cancer randomized to receive chemotherapy with or without Aloe. And the Aloe group had 3 times the number of complete responses, significantly greater objective tumor responses, and 2/3 at some level of disease control, compared to only half in the non-Aloe group. But does that translate out into improved survival? Yes. For example, at 1 year, 70% of the Aloe group was still alive, whereas most of the non-Aloe group was dead. And as a bonus, the chemo was better tolerated in the Aloe group, less fatigue, for example, and better maintenance of their immune system. So given the better disease control, given the better survival, this study seems to suggest that Aloe may be a successful add-on therapy in terms of both tumor regression rate and survival time. Now, this was a randomized controlled study, but not a randomized placebo-controlled study. It's not like the control group was getting like some fake Aloe drink. So some of the tumor response may have been like a mind-over-matter placebo effect. Now, there are potential downsides. As I explained in a previous video, swallowing Aloe can, in rare cases, trigger liver inflammation and cause electrolyte imbalances due to diarrhea or vomiting. For example, there was a case reported of an Aloe-induced low potassium in a patient with breast cancer, which rapidly resolved once she stopped the Aloe, thought due to the laxative effect Aloe can have. If you want to talk to your doctor about giving it a try, note this was not Aloe vera, but Aloe arborescens, a tree-like aloe that can grow to be like 10 feet tall. The concoction they made was a mixture of about 2/3 of a pound of fresh aloe leaves to a pound of honey, plus about 3 tablespoons of 40% alcohol, given orally at a dose of 2 teaspoons 3 times a day, starting 6 days prior to the onset of chemo.